Hi, my name is Tony Gaitatzis. I am the CTO of Personal Neuro Devices. I care about health because health is the most important thing to everyone. It's a universal quality. The healthcare system is changing rapidly. There's a plethora of new devices that have come out recently that measure your blood pressure and your heart rate and your breathing and your sweat and your brain, everything that we can monitor right now, we can monitor almost portably and on the go. This is dramatically different from what it was 10 years ago when you had to go into a clinic and have specialized equipment. You had to sit usually motionless in a lab and be monitored by a doctor. So now we can do the same kind of monitoring in people's day-to-day lives and get a much more realistic picture of what's going on with their health. Let's say you had a cough and you went into the doctor and they did a series of tests. The doctor only sees a picture of your health when you think that there's something wrong. Now we can start monitoring actual health. You go about your day and you monitor, your breathing or your heart rate or whatever, or your pulse, the things that your doctor checks on when you're sick, but you can measure that when you're at work or when you're sleeping or when you're healthy, when you're at the park, at a picnic with friends. And you can start to see the trends of an individual, how their health changes over time, how their health changes when they're sick versus when they're healthy, but also you can see how that health looks, how the picture of health looks on a broader scale with a community or with their country or with the world, and see, people in this area are getting sick. It's propagating at, the bacteria infection is propagating at the speed, and you can start seeing those pictures as well, those trends. A lot of the things that technicians used to do, which is looking at, say, a series of MRI scans of people who came in, that person would start to get a sense of what the trends are in damage and recovery times. Now we can automate a lot of those decision-making processes and a lot of that analysis. And if we have incoming data coming from these micro devices that people wear, that they wear all the time, you can see, and you can tell them with automated tools, this is what you can expect. This is what's happened in the past from other people who are like you. And because of the statistical analysis power of big data, we can start to give individual feedback to somebody based on large groups of people that have similar lifestyles or other variables as them. We can start to classify people at a very personal level. So because all this data is siloed into these corporate databases, and they're not shared with your doctor, they're shared with you on an individual level, but their data formats are proprietary and they don't talk to one another. It's very difficult to create a clear picture of a person's health. It's really difficult to create a trend analysis of what's going on in your community or in your country or around the world. It's really hard for doctors to see what's going on, and it's impossible for governments to make decisions about policy that affect people's health. To me, the solution to the problem of this data exchange and the proprietary siloed data is to create open formats that are recognized in the industry as ways to transfer and package the data, and common spaces to aggregate this data so that doctors, individuals, researchers, and governments can have access to, in particular, anonymized data that we can start to see what these trends are, what population groups are affected by disease or other health issues, but also ways for me as an individual and everyone else to have access to their own health records so they can look at what their trends are. Standards are critical to enabling individuals to create a holistic view of their own health, for doctors to be able to utilize this data, and for governments to make decisions about healthcare policy and healthcare analysis. There's this fledgling technology that holds a lot of promise for us as individuals and us as a society, but right now, there's no one behind the wheel. There's no one steering this ship. And I feel like it's very important for us as a society and us as an industry to come together and make the decisions necessary to steer this ship in the right direction so that it benefits as many people as possible.